Hanji everyone, good afternoon, very good afternoon to all our dear bachas. And yesterday we were sitting on the same platform wishing you good luck, and we are back here with you to talk about the INICET exam that was held today. Right, so let's start asking you, how was your paper today? Let us know in the chat box, and then we will start with our analysis. Yes,
and
so
just
how was it for everyone?
and just to say कि जो था हो गया, एक बार relax हो जाओ, paper हो चुका है. Let's start discussing how was the paper, and we are so happy that we started off here with the wishing you all the best, and we are here to talk about the paper. So first of all, let us see some preliminary observations that many of the students have pointed out. One of the preliminary observation that many students have pointed out to us is, let us see if you can answer, कि femur पे बहुत question आए. So there were a lot of questions on femur. Do you agree? Lot of people said कि they forgot to ask PSM. PSM तो उतना आया नहीं, वो सब PSM के question हो गए छपा छपा छप छप छप.
And I am very
और
glad to
psychiatry
see
tough था.
psychiatry tough tha, and I'm very glad to see ki obs and gynae, yes, I think you all have done well, and I'm super happy with the feedbacks on my Telegram channel as well. We have discussed almost everything, and yes, as usual the class notes turn out to be the best. Yes, so I'm happy. I hope you do all questions on obs and gynae right, because every question that you get right adds to your score, right?
So इस paper में I think when I asked the students like what was the difficulty level or any particular subjects that you found tough, majority of the students were of the opinion that psychiatry, orthopedics and ophthalmology were on the slightly tougher side. So if you found them tough, don't get disheartened. Almost everybody has written the same things when I discuss them on the DAMS Telegram channel. If you're not following the DAMS Telegram channel, it is right time to follow it right now. We'll share the link with you also. So ज़्यादा मुश्किल ये लगा, and then a lot of people were of the opinion pharmacology was primarily from the DVT. And एक और चीज़ जो थी जो बहुत ही interesting है, 43% people from the poll that have done have attempted 190 to 200. 27% people have attempted 180 to 190. So if I add the two, that means 70% people have attempted more than 180. So although we are saying the paper was from a moderate difficulty level, but when I look at the attempting ratio, I feel that almost everybody has almost,
the attempt ratio is quite high.
70% people have attempted more than 180 questions in this paper. So I think that is going to be a good determinant of where you were in the paper. If you have attempted less than that, it is slightly tricky.
Yes, as we said that no matter what the difficulty level of the paper is, try and not go beyond not less than 170, 175, right? So with everyone going on the higher strike rate, I am sure that you have followed what we have told you, and you've kept the number of attempts pretty okay. Yes.
And I hope you enjoyed the Mount Fuji sign from my Telegram channel. I was so happy to see it directly in the paper. And also if you see in my PYQ session also and in my PYT session also, I told you that they will ask you radiology in an integrated fashion. Extradural दिखाएंगे तो treatment पूछेंगे, radiology दिखाएंगे तो anatomy पूछेंगे, this at trauma पूछेंगे. More or less the topics in radiology were similar, trauma, but they show a radiological image. Image with management asked. So this is what is called as horizontal and vertical integration. Horizontal मतलब radiology दिखाया पूछा management, okay. Vertical मतलब radiology दिखाया पूछा anatomy, कि anatomical variant है कि नहीं है. And I'm sure you've attended the detailed anatomical discussions that we've done in the classes.
Okay, although we are still waiting for all option recalls, I think कोई topic vague नहीं था, that is for sure, at least for most of the subjects. I agree some subjects were on the tougher side maybe. But out of 19, I would say the majority of subjects did not have any vague topics. And I remember from one of my incidents from the recent Ultimate App Live class, so I am covering OBGY there. And I remember that I was teaching IUGR and I was teaching them the criterias, and when I was writing, one of the bachas said, ma'am ye yaad karne hain kya NICT, it will be asked, and it came today in the exam. I'm sure it's resonating for all the bachas who were sitting there in the Ultimate App Live class, right? So we are waiting for all correct option recalls, and one by one we will start putting the recall as well. Somebody is asking the answer for the forceps wala question, although
एक अलग वीडियो भी करेंगे
हाँ
उसके लिए
पक्का करेंगे एक लेकिन still, although I don't have all 4 options with me right now, but going from whatever recall I've had, it will be an outlet forceps for that question. Okay.
Okay, and one of the students had said, sir, was it a moderate paper, tough or easy? So I just want to share a statistics with you. 61% of the people who have voted on my survey found the paper to be moderate. 70% people have attempted more than 180. So that gives you an idea. It was a moderate difficulty level paper. It was not a tough one. It was a moderate difficulty level paper. In this paper, around 20 to 40 questions were image based, and previous year questions probably were maybe around 30%, like 50 to 60 questions could be based on the previous year questions or previous year topics. Most people believed that your main DAMS class notes, DBT, INI, PYT and PYQ Kabab, these were the 3 most important resources for this paper. Basic sciences had a slight more representation than the clinical side, which we have already talked about in multiple videos as well. And most people, 56% people finished the paper just on time.
Alright, so I'm going to add, as Dr. Sumer said, the resources which are important. But if you remember, every time I have talked about the difference between INICET and NEET PG, every time I've opened my mouth, I've said they will ask restricted topics, but they will go into the depth. And even in this paper, a lot of questions were purely conceptual. So if you know your concepts well, it's not about knowing vague things, but if your concepts were well, if you could pick up those keywords, you will get the answers. Do you agree with me?
Only a few questions were of the match the following pattern. That is, one of the person is directly writing here. बहुत ज़्यादा match the following नहीं था. Opthal tough था. 51% people believed that opthal was tough, and anatomy again more than 50% people believed was tough. Orthopedics and maybe psychiatry, there was a 35% people who believed it was tough. So you get an idea. And PSM was underrepresented in the paper. I think time management का कोई issue नहीं था किसी को भी. So I think more or less this is the review of the paper for you.
Yes, also as I can see your messages from the YouTube channel, I am sure everyone would agree that direct repeats were minimal, and that's what we have been saying. Don't focus on PYQs, always focus on PYTs. Know the topic and know the topics that are important. They would be asked from very basic things to maybe the clinically applied aspects. So direct repeats बहुत ही कम थे. I think barely 1 or 2 repeats could be put as direct repeats. But yes, PYTs still hold the major chunk, and in fact this is going to be my advice for all of you for the upcoming NEET PG also. Please don't just rely on PYQs. बहुत सारे बच्चे हैं जो कहते हैं मैम हम लास्ट के 1 मंथ में सिर्फ PYQ करने हैं. ऐसा नहीं है. PYQ करिए, but don't give over attention to them. Understand that it will always be the topic, and around that topic that things would be asked, right?
So I can see in the chat box like most people had the similar observation that this paper had PYTs. Like if you remember, I'm sure you remember we've discussed this in all our discussions, that please go through the INI PYT course in the app. So PYT was the game changer, and I think there was surgery question, achalasia cardia. Yes, I think there was probably some people have already mentioned this. Same topic, repeated questions in the site. Yes, we got this feedback also कि एक ही topic पे कई question आ गए. जैसे femur है तो बहुत सारे question थे. That was there. या पिछले साल वर्निक्स पूछा था तो Korsakoff psychosis पूछ लिया. That was there. Radiology images were there, but all in the integrated fashion, like we have already discussed.
And I'm glad that somebody is also commenting, Harsh, that INI mock जो हमने किया था DAMS का 2-3 questions directly उसमें से आए हैं. So we are glad that see, when we prepare a paper, we ensure that a lot of effort goes into it, right? We try and simulate what the real exam is. So I am happy that we are able to contribute, and we will keep contributing for your NEET PG as well. also there are some
And I think,
students.
one of the observations that I have is, I think before madam is going to take your queries, is that this paper is again telling you that if you want to get into central institutes, you need to go and understand things. Only collecting previous year questions, only making custom tests from previous year questions would
Yeah, will not
not
help
work
बच्चा.
out. Paper में वो direct PYQ नहीं आते, वो previous year topic आते हैं. So if you remember in my classes when I was teaching you extradural hemorrhage, I spoke a line कि ये दिखाएंगे पूछेंगे management. When I was teaching you chest CT anatomy, I told you that there could be anatomical variants, and we discussed about different variants also in the class. They may directly come in the exam or indirectly, but the question is, are you able to understand the normal structures? Then only you can rule out and find what is abnormal. So understanding was very important. If you saw the YouTube channel video also before the INICET, I said anatomy की तरह से कुछ पूछेंगे. I have a feeling that they will try to integrate radiology and anatomy. So this is the style that we need to go forward with. All of you who are preparing for next INICET, you should know that the goal should be to understand your concepts.
I completely hands down agree on this. मतलब मैं हर बार आजकल जब मैं लाइव क्लास में पढ़ा रही हूँ, क्योंकि अल्टीमेट आप लाइव में सेशंस चल रहे हैं, मैं हर बार बोलती हूँ कि आप लोगों को ऐसा लगता है कि INICET is going to ask something really great from research work or things like that. No, if you look at the questions, they're trying to see how much you understand. They are asking about basics of a topic, and I have seen this trend, and it is reverse of NEET PG. NEET PG में, and this is going to hold true for upcoming exams. Over last 3-4 sessions, NEET PG में ज़्यादा clinical questions आते हैं. You be prepared for it. INICET reverse हो चुका है. बहुत सारी basic बातें जिनको आप, क्योंकि वो basic हैं, you take them as one-liners, right? आपको लगता है one-liners आ रहे हैं, but they are actually core basics. Similarly, NEET PG, mark my words, will be having more clinical vignettes than INICET, right? And that's what is the trend over the last 3 to 4 sessions if I compare to exams. For example, I remember I was teaching twin pregnancy the other day in Ultimate App Live, and just to explain the timing of divisions, मैंने सिर्फ समझाने के लिए बोला कि बेटा DCMA जैसा कुछ नहीं होता है. There is, if it is dichorionic, it will be diamniotic, and it's like a tiny little concept, and it came in the exam. Yes, so this is going to be what you need to understand. You will have to ensure that your concepts are good. Only having notes, beta ji, or only memorizing bacha is not the right way. Learn concepts and learn the application and learn integration, and you're sorted, right? And we'll keep coming back and we'll keep telling you what you need to do for NEET PG as well, as we have, that is the next exam that we are going to focus on, right?
So let me give some pointers. NEET PG will be a totally different exam from what you have given. In that you will have more clinical predominance and smaller clinical vignettes will be there in the paper. You can keep this video for your later on review also. It's very important. While INICET over the last few years we have seen has become more fact oriented rather than
Yes.
a clinical vignette oriented. Although the facts are integrated, they require some deep application, but it's like you have to know it to solve it. Second thing we have seen is basic sciences are always more represented in INICET like this. Out of short subjects, psychiatry is usually on the tougher side in INI because NIMHANS also contributes to the paper.
Yes.
I have told you this in multiple of my analysis videos. And when they go to radiology, I have already told you they will ask you either horizontal or vertical integrated. One more thing I have told you is that 61% of the people found the paper to be moderate, and 70% of the people have attempted more than 180. That tells you that the paper was more or less doable if you were good at the previous year topics, not the questions.
So I think if we have to literally put it as, was it, so I'm going to put an MCQ forward to you. Was it easy to moderate or was it moderate to difficult for all of you? Because moderate to sab bolenge. So now I want to know in the chat box, how many of you say was it easy to moderate or was it moderate to difficult? Because that is going to tell us what is likely going to be the cutoff for the exam. Yes?
I'm so happy that many of you are saying the paper was set by DAMS teachers this time. It was like the DAMS test. We are so happy. We are so happy कि हम कर पा रहे हैं. और एक हम ये भी चाहते हैं आपको बताना है जो मुझे लगता है बहुत ज़रूरी है I think a lot of people have already started firing answers.
Yes.
Moderate to difficult, easy to moderate, moderate to difficult, moderate to difficult. Contrast safe in CKD patients. If you remember my class, मैंने बोला ना MRI में का contrast safe होता है, ना CT. Ultrasound contrast will be safe. Ultrasound contrast will be safe, beta. Easy to moderate, easy to moderate. Again, I am saying it was moderate. Although some of you want to say it is moderate to tough, but I see it as moderate. I can see it from the attempting ratios. I can see it from the polls. It was moderate difficulty level.
So also, now what is my suggestion, how you take forward this. So please understand, don't bother too much about recalls. Let what has happened happen. Definitely see the recalls. We will start putting it as well. They'll teach you some things. Yes, you will identify some of your mistakes. But what is more important is that no matter what this exam was for you, right? For some it may be easy, for some moderate, for some it may be tough. But you have to understand every exam has to be taken as a learning experience, and we have to get better for the next opportunity knocking our door. This is not the last opportunity for any of my bachas. You all have a bigger opportunity coming up, and that is going to be NEET PG. So please don't let your morale go down. Please don't think that papers are always going to be very tricky or they are going to be very difficult. It's not going to be like that. Yes, you just have to use the right resources at the right time. That is also important. Last में क्या करना है is very different from बीच में क्या करना है is very different from शुरुआत में क्या करना होता है.
I think a lot of students are saying that DVT was useful, and I am saying again DVT will be even more useful for your NEET PG exam. अगर अभी तक DVT नहीं किया, that will be a big mistake. It will be helpful for your NEET PG also. And more twisted questions, more factual. I think that is what most of the students are writing. Let me ask you another question. How many questions did you attempt? So that everybody gets an idea. How many questions did you attempt?
Yes, you can start typing. And while you are typing about your number of attempt questions, and please be truthful, I also want to bring about a change. I think I have seen that the number of image based questions has also reduced. Am I right? This is what is the feedback that we have been getting, right? So I think the image based questions are relatively less in this paper, but you can definitely comment on the IBQs. Also, when we say IBQs, were they pure IBQs, which means identify, or were they associated with some short clinical history, right? So
because of the IBQs, I think radiology was fairly represented in this paper, fairly represented, but the questions were all on the integrated side. They could not be placed into one subject. They were like multi-subject kind of questions.
So look at what we are getting as the recall, right, is that almost everyone who is here in the chat box has attempted more than 185. I have seen very less students writing that the attempt ratio is less than 185. So yes, a couple of you have between less than 180 also. I do see a few of them, but then again, which means that the attempt ratio is high, which means it's for almost all questions, right? Probably there was confusion in some with two options. कोई question ऐसा नहीं था जिसमें आपको 3 या 4 options में confusion हो. So it boils down to almost maybe in questions where you feel it is doubtful, you were confused about 2 options. Yes, am I right with that?
And one of the conclusions that we have drawn from this INICET once more is that whenever we see a paper which is more conceptual, as compared to any short course, the main class notes, the DAMS classes that you attend, where you are trying to understand the concepts, they become more important. And that is reflected in all the polls that we have done, is that attending the class, understanding the concept was more important than revising. That was rule number 1. Number 2 was previous year topics were more important than previous year questions. Number 3, they had more basic science representation. Psychiatry was definitely set by NIMHANS, was on the tougher side. Clinical vignettes were not there, maybe very few.
Very few.
Image-based questions were there, maybe, but 20 to 4, but not with a clinical vignette.
Yeah, the image questions did not have a clinical history attached to it. Yes, so which is also a little change. Earlier INICET, whenever they used to give a image, there was a short history. चाहे एक line की हो, but they used to give a short history. Now whatever IBQs they are asking are usually coming without any history. So yes, there are histo images, there are radiology images, right, and they are without any clinical history as far as INICET goes. Yes.
So the
Okay.
paper more or less was like, say, slight to bend towards the factual part, more basic science, and maybe, you know, your memory was less useful than your deep understanding in the paper. If you understood, you could, you know, try to find and guess. Like there was a question where CT Hounsfield value of water was 0, which is directly from the classes, and I think, I'm sure you should have done it. Like this kind of questions were in between there. So my question is, you have to gradually, what we'll do on the DAMS channel is that we'll start with the recall session after this.
I think
And
from 4:15 onwards, we are going to start with the recall sessions
yes,
as well.
and by tomorrow or day after tomorrow, we'll finish all the subjects. Don't rush for every answer correct or wrong.
Yes.
Just have
so,
patience.
So now what is my advice? Even when you see the recalls, see, I said this a day before the exam. Yesterday also I said this, that most of you, for many questions, it should be a reflex answer, right? अब बात किस पे डिपेंड करेगी? बात उस पे डिपेंड करेगी कि how many questions were you confused in 2 options, right? And as I said, one of the strategies is to go with your first instinct, right? How many of you have changed more answers, right? So when you kept them for review, did you change more answers is also going to be a determining factor, right? So now I want to know from the chat box, how many of you kept more number of questions for review? Maybe you can start writing how many questions approximately you kept for review, and how many did you change answers in, because that
And
is
also,
going
was
to be
any set long for you, or like 4 set में से कोई ऐसा तो नहीं था, 2 set ज़्यादा लंबे थे, 2 छोटे थे, ऐसा तो नहीं था? Just let us know about the sets. I think one student is saying one of the sets was very factual.
okay. The 4th set they are saying, right? So okay, so I think
One set was long, one set was factual, one set was long, one set was easy. I think that is what the general consensus seems. और ज़्यादा choices में 2 choice में problem आ रहा था.
okay, so 10. I think they are saying approximately 10 MCQs per set. There was a confusion in 2 options. Is that the relative number for everyone, or is it less for some or more for some? So if we keep the target, or I would say comparative level as 10 MCQs per set, where you were confused in 2 options, right? Where do you stand? So I am taking 10 as the reference limit, and then I am asking in each set, in how many questions were you confused in 2 options? If the reference value is 10, where do you stand? So you know, that will give you a good idea whether you were more confused than others or less confused than others, right?
So what we have learned is that most of the students found 2 sets to be on the slightly longer duration. And one was shorter and one was more factual. I think this is the general review. So if you were feeling the same, you have to understand that most students were feeling the same. There were questions which had 3 to 4 questions were of assertion reasoning type, and there were around 20 or 30 questions which were multiple correct, and they were matched the following questions also from biochemistry. I think many of you have written this. So do let us know if you, yes, assertion reasoning was a new kind of paper.
So which is interesting. नहीं new नहीं है. Assertion reasoning पहले भी एम्स में आया था. Right, I always teach in my class, especially when I'm doing some concepts, I always give them examples of typical areas where they can frame RNA MCQs only and only for INICET. So ये INI वाले हर 2-3 सेशन के बाद कुछ reason assertion MCQs जरूर डालते हैं, and it repeats. It won't probably come in next 2 sessions, when then it again comes in the 3rd session. So you should always be prepared with some typical areas where RMA questions can be asked, okay?
So if we go deeper into the analysis of this paper, what we have learnt is, and I want all of you to understand, that time management was more block wise. पूरे पेपर का टाइम मैनेजमेंट नहीं था, लेकिन कुछ ब्लॉक्स लंबे थे, उसमें टाइम मैनेजमेंट में मुश्किल हो रहा था. एंड वी हैव टू कीप दिस इन माइंड फॉर फ्यूचर एस्पिरेंट्स. Number 2 was multiple types of questions were there, multiple completion types, match the following, biochemistry में भी थे, assertion reasoning, image based questions, and single best answer. Predominant was single best answer, but there were different kind of questions in the paper that were taking you time and that were, making you getting confused in the final two options. Previous year topics were represented a lot, not the previous year questions directly. Previous year topics were there. Anybody who was good at DVT, INI, PYT had that advantage of previous year topics. And again, I would re-emphasize that NEET PG will be a different exam. Don't get confused with this paper.
Yes.
You will find it to be more clinical, more clinical vignettes.
Yes.
Don't get confused between this paper and the NEET PG preparation.
And NEET PG will definitely have a higher percentage for all clinical subjects. So whether it is, I know surgery was less this time in INICET.
PSM
right?
was also less.
Yes, but it is going to be the reverse in NEET. NEET PG
Yes.
would have significant number of surgery questions. In fact, out of medicine and surgery, they will ask more of surgery, right? So medicine, surgery, obs and gynae, you will have a lot of questions. PSM also for NEET PG remains important.
Yes.
Don't think कि यहाँ कम आया है तो वहाँ भी कम आएगा, ऐसा नहीं होगा. Right, so you don't have
Even
to change
PSM
your
and
strategy.
I think biostats was less, not there, I think.
Biostats has been coming less for last 2-3 sessions in INICET.
Okay, and the entire idea is that in INICET sometimes they do a little bit of lopsided weightage. We have talked about this in multiple of our videos कि वो थोड़ा सा कोई सब्जेक्ट कभी कभी कम आ जाता है. जैसे इस बार थोड़ा सर्जरी कम हो गया, इससे पहले बार में कई बार मेडिसिन कम हो जाता है, कभी ENT कम हो जाता है, कभी PSM, ऐसा हो जाता है इसमें, because they have only 200 questions and they are trying to do a lot of integrated kind of a question in the paper.
In fact, अगर आपने हमारे we did a couple of sessions before this exam on YouTube. अगर आप उन्हें जाके सुनोगे तो हमने बोला था बेसिक साइंसेस आएंगे और फोर्थ ईयर सब्जेक्ट्स भी आते हैं, ठीक है. I typically mentioned for third year subjects कि ENT, ऑफ्थैल, PSM, ये कभी कभी बहुत ज्यादा उसको स्क्यू कर देते हैं. मतलब ENT में से आ गए क्वेश्चन तो ऑफ्थैल बहुत कम हो गए, ऑफ्थैल में से आ गए तो ENT कम हो गए. आगे के लिए भी प्लीज रिमेंबर दिस, it is never something which is going to be definite. They skew the questions always. ENT, ऑफ्थैल, PSM ये skewed आते हैं और सार्पो भी कभी कभी skewed आ जाता है. मतलब एनेस्थीसिया से बहुत कम है मगर साइकी से ज्यादा आ गए and so on. So these are the two areas where INICET people will skew the ratios, right? First year and second year वो डालते हैं basic sciences as compared to NEET PG here has a little higher weightage. Fourth year subjects भी आते हैं. It is typically the third year where they skew. Okay.
I think TND के paper will also be a good guide to any exam. Whenever you are appearing for an exam, it's always a good idea to review your TND papers. Many students have written to me कि वो TND revise करके गए थे, उसको फायदा मिला क्योंकि पेपर में अप्रोच के अंदर डिफिकल्टी लेवल को देखने में, फाइनल 2 चॉइसेस को रूल आउट करने में हेल्प मिलता है. एंड ऑल्सो व्हाट आई वुड से इज कि इवन इन द पेपर लाइक दिस विच इज ऑफ say moderate difficulty level, some subjects underrepresented, still we have seen most people have attempted 180 plus. So at the end of the day, cutoffs will remain similar to what we had in the November exam.
Yes.
I've asked many people and majority, around 40% people have said कि ये difficulty level November के exam के जैसा ही लग रहा था. So, we are like looking at a similar cutoffs as the November exams. I see many people asking कि क्या cutoff होगा ये. November exam के जैसा ही लगता है.
Okay, don't worry. We have plans in mind for the upcoming NEET PG. वो हम जरूर करेंगे. We'll have a predictor series. We'll have the mini test series. We have PYQ का BAP also coming up. So don't worry. We will do our side of the effort. You will do your side. Yes, and together we'll make it happen. It's not a big deal at all. Please relax for today. You have done a good job. You tried your best. You studied for it. You were serious for the exam and you have done whatever best you could on the day of the exam. Right?
I'm happy. I think कई बच्चों ने जो CBT दिया है INICET का वो रिफ्लेक्ट किया रियल एग्जाम के अंदर भी, प्रैक्टिस भी, एनवायरनमेंट भी. आई एम हैप्पी दैट वी कुड हेल्प यू सिमुलेट द रियल एग्जाम. डोंट मिस आउट ऑन अपेयरिंग फॉर द NEET PG CBTs because this time even NEET PG will happen in blocks. Also, I want to tell you today that it is very, very important to take a deep breath, relax, analyze what you did right, what you did wrong. लेकिन ये मत सोचो ये आखिरी अपॉर्चुनिटी, इसके बाद बहुत बड़ी अपॉर्चुनिटी आने वाली जिसका नाम है NEET PG. तो ऐसा मत सोचना कि ये पेपर खराब हो गया तो वो भी खराब होगा. वी आर लुकिंग एट 2 different exams altogether. So keep in mind there is a big opportunity coming up with NEET PG. What we will do at DAMS is we will be now, after our video will start with the recall series by our esteemed faculty members. We will be looking at the question papers with you, what was the question and what will be the probable answer. But with a pinch of salt, please remember sometimes the choices in recall may not be perfect, तो घबराना नहीं है
हाँ
आपने.
बिल्कुल चिंता नहीं करनी है. This recall is only to give you a rough estimate, because you know usually on the first day of the recall the options are not properly framed. Still the faculty will try their best, they will frame whatever best recalls they can get. मगर मान लो कुछ ऊपर नीचे है तो आपको बहुत चिंता करने की जरूरत नहीं है, ठीक है. सो वी डोंट वांट एनी बच्चा टू बी वरीड. प्लीज रिलैक्स. आप करके आए हो, जो भी करके आए हो अच्छा करके आए हो. लीव इट नाउ. हम सिर्फ इसलिए कर रहे हैं रिकॉल कि हमें आइडिया हो कि क्या टॉपिक्स आजकल आ रहे हैं. समझ रहे हो मेरी बात? दिस इज द मेन गोल.
This recall will also be live on the DAMS-eMedicoz app, so that if you are away from the social media, if you are a good student only on the eMedicoz app, not on the social media, we will have it directly on the eMedicoz app also, as well as YouTube. Also, after that we will start with the NEET PG predictors and the mini test series. We will come up with the announcements for your NEET PG. I hope you found all our initiatives useful, and I hope to continue serving you with the best of our ability, best of our academics, to make sure that we are able to help predict the subsequent paper as well. I wish you all the best, and I am telling you, आप जो कर सकते थे आप करके आ गए हो. एग्जाम हो चुका है, अभी उसके बारे में बहुत सोचना मत. अभी सिर्फ ये सोचो कि whatever I've done, I will do even better in the NEET PG exam. I wish you all the best. Keep rocking.
And what are you going to tell yourself, and what are you going to tell your parents? You're going to tell yourself and your parents the same thing, and you're going to tell them the truth. And what is the truth? That I worked sincerely and I have tried my best. Okay, these 2 lines, they are only 2 lines, but they have very big value, right? So I have faith in all my bachas that you have worked for it sincerely and you have done whatever best you could. Rest, let's leave it. Whatever will happen will be for your good. You will have opportunities, whether in terms of this exam or whether in terms of the next exam. You will never be short of opportunities, right? So always keep that in mind, that you are the best people. Okay, there is no denial on that. You guys are the best in the society and you're going to rock it. Okay, so now relax. अगर नींद पूरी नहीं की है, take time out, sleep, go for a walk, right? Just let it loose, and from tomorrow we'll plan again. We'll put up a new strategy. We'll plan our way forward. Okay?
आज अगर रिकॉल वीडियो नहीं भी देखोगे कोई फर्क नहीं पड़ेगा, घबराना नहीं. टेक इट इजी. आवर फिंगर्स क्रॉस्ड, ऑल आवर ब्लेसिंग्स, ऑल आवर प्रेयर्स विद ऑल आवर स्टूडेंट्स. मैं चाहता हूं आपने जितनी आपकी मेहनत है उसका आपको पूरा रिवॉर्ड मिले. माय ब्लेसिंग्स आर विद ऑल ऑफ यू. Also my reminder that any exam result will not determine your self-worth. अपनी self-worth को exam की performance से मत आंको. आप उससे ज़्यादा precious हो. हमारे लिए, अपने parents के लिए, you are very precious. So stay positive and we love you all. Take care of yourself, and we announce that we will be starting with the INICET recall series after our video on this channel. Watch out for the teachers coming up with the recall session.
Also, just a little thank you note from all our teachers and from our side. Thank you for making us a part of your journey. We'll try and keep contributing in whatever best way we can, right? Even if it is 1%, we will try our best. Okay, so take care everyone. Loads of love, and I'm sure सब अच्छा होगा. ठीक है?
Wish you all the best, beta. Wish you all the best.